Welcome to this lecture about enzymes. My name is Geir Flatabø. I am a medical doctor. I've been interested in chronic illnesses and ways to relieve these in not only using pharmacological special medical pills, etc. In this digging after other ways to relieve problems, I come into something what I think is very interesting. So this is what I'm going to show you in this lecture or video. I'm not English, as you can hear, but I will try to speak as loud and easy that you can understand me anyway. First, in general, enzymes, the name comes from a Greek word zyme, what it means something in sourdough. It's used as a name for different biological catalysts, if you look into Wikipedia. They are molecules that is a part of and helps and makes difficult or else impossible chemical reactions that they may happen. These reactions can be degrading, breaking down a molecule, or the opposite, building up larger molecules. And the enzymes are found in living and in dead organisms made from proteins. The enzymes themselves are also built up from subunits like you call cofactor, that is a part that is necessary for the enzyme activity, but not necessarily an inherent part of the enzyme molecule. Then we have the coenzymes, that is this organic cofactor, and the prosthetic group, that is permanent associated to an enzyme. And the name holoenzymes means it is catalytic active, it is able to do a job. And we have the apoenzyme, that is the inactive, plus the cofactor makes this holoenzyme, this active enzyme. Enzymes are very important in digestion, and digestion is also a key factor, it seems, in very many chronic illnesses. And the digestion is a physiologic and biochemical process where food is chewed and thereafter further degraded by mainly enzymes to be broken down into small enough parts that gut is able to absorb into blood and lymph to be used in the body. So enzymatic digestion starts with amylase, breaking down starch in the mouth. These are the largest molecules that we eat, and it needs more time to be fully digested. So after swallowing, the food or the chewed food is swallowed down into the stomach, where the protein digestion starts in an acidic stomach. Then virtually no mammals, in fact, are able to make enzymes or so-called peptidases that are able to cut proline in its own digestion. Proline is an amino acid, and the amino acids are building blocks of proteins. So further digestion, peptides rich in proline are assimilated into gut lining, not being fully degraded. And approximately 30% of all amino acids that goes from gut into your body, they are assimilated as peptides. And peptides are small proteins, small amino acid chains, while what we call proteins are the larger amino acid chains. So assimilating or taking up small amino acid chains instead of only the amino acids as an isolated molecule is an effective but also then a risky way to get building blocks, building parts for your body into your body from your gut. Here a picture of the amino acid proline that is especially in the way that it makes a kink in the protein. This makes like if you have a usual amino acid chain like a string, then proline comes and then it turns the opposite way. In this way it makes three-dimensional properties to the protein like enzymes and like collagen in your body that has to have kinks, not only straightforward chains. A friend of mine, Dr. Carl Reichelt, he's not with us anymore, but he was studying peptides from urine in patients with psychiatric diagnosis, and most of the psychiatric diagnoses are these chronic illnesses, chronic problems. He found increasing peptide loads, increasing wealth of peptides in urine, and these were paralleling the increased symptom load in the patients. He found different kinds of peptides, and these were correlating to different diagnoses. And he also found that these peptides originate from gluten, from casein. One from the casein is called bovine caseomorphines. He also found some from fungi, one called dermorphine, another called deltorphine A. These are peptides that have an effect on you, on the body. So his hypothesis was that, okay, we find more of these in patients, then possibly or probably these patients lack or have failing enzyme apparatus. These enzymes that should be breaking down these proline-rich peptides, often called DPP4, dipeptidyl peptidase. So peptides have varying biological and pharmacological activity. Especially known is opioid activity. Opioid peptides may explain much of these psychiatric symptoms, like psychosis, like depression, like some that have high pain thresholds, etc. These peptides might also be antigenic. It means they make some kind of inflammation in your body. And the peptides may be glucosylated. There might be some glucose or other carbohydrate linked to them. And these carbohydrate links, these will increase the resistance to be broken down. The enzyme called DPP4, dipeptidyl peptidase 4, is a special peptidase that usually break down proteins or peptides with proline. Because proline itself, due to it makes this kink on the peptide strain, then it will stop the normal peptidase or proteinase enzyme. It will stop it from function. So therefore your body have these specialized enzymes inside. It's bound into the inside of your cell together with guanyl cyclase and dopamine D4 receptor. And in autistic children, it's not too seldom found antibodies against this dipeptidylpeptidase 4, DPP4, explaining, or at least a possible explanation for why autists have increased amounts of proline-rich peptides in the urine. And of course, also we find different other errors in other enzymes with autists. So, what to do? Carl Ludwig Reichelt told me about a guy in Australia that had found some interesting enzymes that might be fruitful. In fact, some of them come from fruit. So there are some plant products, some fruits, etc., that contains peptidases, that contains enzymes that are able to break down, help your body break down problematic proteins and peptides. They are known from pineapples, called bromelain, from figs, called ficin, from kiwi fruit, actinidine, from papaya, papain, and less known from the gingers and turmeric and galanga, all three very well-known root spices, herb spices, originally from the Asian kitchen. And you find more about the products at Biohawk in Australia. He found that enzymes, especially from the gingers, the ginger, the turmeric and the galanga, they have effect in if you do in a test set where you see how to break down proteins. These zingibain that has then DPP4 activity. It has its maximal effect in rather high temperature, up to 67 degrees centigrades. Then it will be inactivated. So if you want to use ginger in your food, you should not cook it with. You should use it in your cold or only a bit heated food. He could also show that these zingibain, it's also absorbed from the gut to blood. That means it might be doing a job in the food you make. It might be doing a job in your gut, and it will continue doing a job in your body outside the gut, in the whole body. Another effect than only being a proteinase peptidase is also that it activates macrophages. It means it has an immune enhancing, immune increasing effect, making macrophage more active. Even more upside of these enzymes, they have no negative long-term side effects in animals or human in rather high doses. So these are a rather good thing to think of if you compare it to lots of modern medicines that have rather not too nice side effects. So just to show an illustration from ginger, from turmeric and galanga, common used spices. It could be strange to think or difficult to believe that zingibain or the bromelain are able to do anything outside the gut, but it's well known that whole proteins might be absorbed through a healthy gut lining. So There's nothing special strange about it. Botulinum toxin, the deadly toxin from the botulinum bacteria, is a large protein that is taken up as a whole, and that's why it exerts its deadly effect. And the same toxins from tetanus bacteria, it also is an enzyme like zingibain. So these examples show that there's not a special thing for these enzymes. It's a rather common natural effect or capacity of special enzymes or proteins. A well-known fruit, the pineapple, like a large pine cone, but a lot better taste. This property that mammal guts do not in themselves contain prolinases, enzymes that break down proteins with proline. This gives an opportunity for microbes in general to put proline in their proteins, in their peptides surrounding their cell membranes, in a way to protect themselves against enzymatic attacks. And your possible way to counteract this is then to use pineapples. And if pineapple is not good enough, then you should look at Pine Crush. This Biohawk product made from pineapples. It's a special kind of pineapple that is rich in bromelain and is rich in a special glycosylate peptidase, glucosidase, that are able to cut off the glycans, the carbohydrate, upon these proteins or the cell membrane. So if you first do a job with bromelain from pineapple or from pine crush, then you make it more easy for the prolinase from zingibain to do the next job. The proteins and the cell membranes of the microbes get very much more vulnerable to other enzymatic and immunologic effects. The microbes might be inactivated, they lose their infectivity, and these are not only bacteria, it might be fungi, it might be different disease-causing viruses like CMV, Epstein-Barr, and of course the common strep and staphylococci. 3 pictures demonstrating the effect. To the left you see tonsillitis. You see how ill he is with high temperature and infected by streptococci and perhaps some other disease-causing virus and bacteria. He gets some treatment with pine crush and zingibain, and after 6 days you see the color has paled and the tonsils are much nicer to have in your throat. There is a surge, there is a campaign to get doctors to use less antibiotics. This is due to especially what's called antibiotic-resistant bacteria, and one of the worst are MRSA staphylococci, methyl-resistant Staphylococcus aureus, yellow staphylococci. To the left, head, scalp wound that is badly infected with MRSA. Then treated locally with pine crush and relief, that is bromelain and zingibain, and after a few days there is an impressive positive effect, much better looking wound, and the staphylococcus is gone. I said something about the possibility to take not only bacteria but also virus. Cytomegalovirus, CMV, is grouped as a kind of herpes virus. It's classified like that. They are, this is a way of showing how the virus looks. So at the outside it protects itself with so-called glycoprotein capsules. These glycoproteins are also a way that the virus protects itself, and also a way that the virus can connect or find a way to a cell that it wants to infect. It's the same principles in bacteria, here shown a stylistic Borrelia bacteria. Outside with peptides, proteins, glycosylated for protecting, and also for a way of, you might say, communicating or infecting the host. Even if they are have their own ways to compete to defeat our immune system, a way to get around these ways of protecting themselves, these plant enzymes comes in. Of course, microbes, most of them are friends. Think about your whole gut flora, your whole gut microbes. They are there, they should be there, they are your friends, but not all are friends, like Borrelia, like these disease-making viruses. So a way to attack them back is using enzymes. They can do their job, not interfering if there are these antibiotic resistance. They do their job anyways, to digest, to inhibit, to break down cell membranes, structures, so the microbes are inactivated and accessible to your immune system. Citing from a statement from a patient that were badly hurt by what's called chronic Lyme. No effect from antibiotics anymore, very little relief from other products, but these enzymes really made a turnaround in his health. Influenza virus, same way of dealing with nature. It has a viral capsid outside, and these proline peptidases, zingibain in relief, has an effect in breaking down the viral capsid. Biohawk has then combined this with green tea that also have some scientific documentation for effect against viral disease, especially influenza virus. So if influenza is a problem, well, you should try relief green tea. It's well known that some cancers are impacted. They are, or you should relate it, maybe caused by virus. Here's a case with Hodgkin's lymphoma that was treated with Biohawk relief, and it was not only treated, it was successfully treated. The really nice thing is that you can use it even if you use standard anti-cancer treatment, as it does not interfere. It rather makes other treatments more effective also. It is really a nice thing to have extra. Studies showing that so-called proteolytic therapy might have an effect in cancers in general, not only this Hodgkin's lymphoma. The way of using it, or the therapeutic with the possibilities to use plant-based enzymes like Digest Easy, like Relief, like Pine Crush, seems to be very large, in that we see in chronic diseases in general there is either microbes that play a role, that have some negative influences on the disease progress, and other not so recognized microbial problem. But of course there might be microbes also. Veronica was a small child diagnosed with autism. Her mom heard about Relief, heard about these plant product enzymes. She wanted to try. She tried for Veronica the so-called 2-step and 3-step treatment plan, and already after 30 days Veronica started talking. She started playing with toys again, and from having no words she started repeating what others said. She would now answer yes on adequate questions to show that she understood. She showed interest, really interest to learn new things. That is a typical problem with those worst cases of autism. The mother found she would continue use Biohawk, for this was a miracle. Walking through the use of a new way to look at chronic illnesses, the use of enzymes, protein degrading enzymes, glucose bonds degrading enzymes, the bromelain, etc., in diseases. These are not registered as medicines. If we try to do that, they would be a much higher price. It would be much worse for you to reach to. So these are food supplements, effective as they are, with a huge possibility and potential for you and your chronic problems.